A man in his 50s, we'll call him John, noticed his gums would bleed when he brushed his teeth. Not every time, but often enough to catch his attention. He was also feeling more tired than usual, the kind of tired that didn't improve even after a full night's sleep. But he was in his 50s, working hard, looking after his family. He assumed it was just part of getting older. Most of us would probably think the same. What John didn't realize was that this wasn't just about age. The bleeding gums were a sign of ongoing inflammation, and that constant fatigue was his body fighting something he didn't even know was there. The problem had started in his mouth, but it was beginning to affect something far more serious: his heart. His story is a reminder that important health problems don't always announce themselves clearly. Sometimes they begin quietly, with small changes that are easy to dismiss. When we think about protecting our heart, we usually think about diet, exercise, and cholesterol. But there's another area people don't often consider: their oral health. Today we're talking about a condition where the mouth and the heart are closely connected: infective endocarditis. Infective endocarditis, often called IE, is a serious infection of the inner lining of the heart, especially the heart valves. It happens when bacteria enter the bloodstream and settle inside the heart, where they can grow and cause damage. One of the reasons it can be dangerous is that the early symptoms are often vague and easy to overlook. People may feel generally unwell, tired, slightly feverish, or have night sweats. Sometimes these symptoms come and go over weeks or even months. It can feel like a lingering flu or just a general sense that something isn't quite right. This slower form is sometimes called subacute bacterial endocarditis. If it isn't recognized and treated, it can lead to serious complications. In this video, we'll look at how oral health and heart health are connected, the symptoms to watch for, and most importantly, what you can do to protect yourself. This isn't just about a rare condition. It's about understanding how the body works and recognizing warning signs early. So how can a problem in your mouth affect your heart? Your mouth is home to many different types of bacteria. Most of them are harmless. But when oral hygiene slips, a sticky layer called plaque builds up on the teeth. This can irritate the gums, causing them to become red, swollen, and prone to bleeding. This early stage is called gingivitis. If it continues, it can progress to periodontitis, a more serious form of gum disease. The gums start to pull away from the teeth, forming small pockets where bacteria can collect and multiply. At this point, the gums are chronically inflamed and bleed more easily. When the gums are inflamed, everyday activities like brushing, flossing, or even chewing can allow bacteria to enter the bloodstream. This is known as transient bacteraemia. In most healthy people, this isn't a problem. The immune system clears the bacteria quickly. But the risk becomes higher if this exposure happens repeatedly, especially in people with certain heart conditions. The American Heart Association has noted that repeated exposure to bacteria from everyday activities may actually pose a greater risk over time than a single dental procedure. We've also known for years that gum disease is linked with conditions like heart attack and stroke, largely because of ongoing inflammation in the body. For infective endocarditis specifically, the risk is greatest in people who already have a vulnerable heart. So that bleeding gum John noticed wasn't just a minor dental issue. It was a sign of inflammation and a possible pathway for bacteria to enter his bloodstream. Once bacteria enter the bloodstream, they don't usually cause problems. A healthy heart lining is quite resistant to infection. But if there's an area that's already damaged or abnormal, it becomes easier for bacteria to settle there. People at highest risk include those with prosthetic heart valves or valves repaired with artificial material, a previous history of infective endocarditis, certain congenital heart defects, a heart transplant with a valve problem. But sometimes the risk isn't obvious. As we age, valves can develop small areas of wear and tear. Some people are born with slightly abnormal valves and don't know it. Past illnesses like rheumatic fever can also leave scarring. These areas can create slightly turbulent blood flow, and bacteria can attach more easily there. Once attached, the bacteria begin to multiply. The body tries to contain the infection by sending platelets and proteins to the area. But instead of clearing it, this can form a protective layer around the bacteria. This buildup is called a vegetation, a cluster of bacteria, cells, and debris attached to the valve. As it grows, it can damage the valve, making it leak or function poorly. That puts extra strain on the heart and can eventually lead to heart failure. Small fragments can also break off and travel through the bloodstream. Where they end up can determine the next complication. At this stage, John still just felt tired. but the infection inside his heart was slowly progressing. One of the most challenging things about subacute infective endocarditis is how nonspecific the early symptoms can be. Common signs include persistent fatigue. This isn't just normal tiredness. It's a deep, ongoing exhaustion caused by the body constantly fighting an infection. Low-grade fevers and night sweats. These may come and go and are easy to mistake for a viral illness. Aches and weight loss. Muscle aches, joint pain, and unintentional weight loss can develop over time. A new or changing heart murmur. A doctor might detect this during an examination if a valve is affected. Each of these symptoms on its own can seem minor or unrelated. That's why they're often explained away. John experienced several of them over weeks but never connected them together. If infective endocarditis continues untreated, complications can develop. One major risk is that small pieces of the infected material on the valve can break off and travel in the bloodstream. If one reaches the brain, it can cause a stroke. These clots can also travel to the kidneys, spleen, or limbs, causing damage in those areas. Another serious complication is heart failure. If the infection damages a valve badly enough, it may stop working properly. Blood can leak backward with each heartbeat, putting sudden strain on the heart and lungs. This can lead to severe breathlessness and requires urgent medical treatment. If you're finding this information helpful and want to learn more about how to protect your health, consider liking the video and subscribing to the channel. It helps support the content and ensures you don't miss future topics. Now let's look at how doctors diagnose and treat this condition. When infective endocarditis is suspected, doctors use a structured approach called the modified Duke criteria to help make the diagnosis. Two key parts are: 1. Blood cultures. Multiple blood samples are taken to see if bacteria are present. This also helps identify the exact organism so the right antibiotic can be used. 2. Heart imaging. An echocardiogram, an ultrasound of the heart, can show vegetations, valve damage, or other signs of infection. Sometimes a transesophageal echo is used for a clearer view. There are also supporting clues such as fever, evidence of clots, or a history of heart problems. In John's case, the picture became clear once tests were done. The infection in his heart explained the fatigue, the fevers, and even the bleeding gums. Treatment is intensive and usually involves two main parts: antibiotics and sometimes surgery. Patients are given strong intravenous antibiotics, often for several weeks. These are needed to reach and eliminate the bacteria attached to the heart valves. In some cases, surgery is required, especially if the valve is severely damaged. The infection isn't responding to antibiotics. There's a high risk of stroke from large vegetations. An abscess has formed. During surgery, damaged tissue is removed and the valve may need to be repaired or replaced. Recovery can be long, but treatment can be life-saving. The most important message is that many cases can be reduced through prevention. Good oral health is key. Brushing and flossing daily, along with regular dental checkups, helps prevent gum disease and reduces the chance of bacteria entering the bloodstream. If your gums bleed regularly, it's worth getting them checked. It's a sign of inflammation that shouldn't be ignored. Some people are at higher risk of infective endocarditis, especially those with prosthetic valves, previous endocarditis, certain congenital heart conditions, or specific transplant-related valve problems. These individuals should be particularly careful with oral health and follow their doctor's advice. In selected high-risk patients, antibiotics may be recommended before certain dental procedures, but this is now limited to a smaller group than in the past. General health also matters. Managing conditions like diabetes, avoiding smoking, and being aware of symptoms can all help. We started with John, who assumed his bleeding gums and fatigue were just part of getting older. He didn't realize that a serious infection was developing in his heart. Infective endocarditis is uncommon, but it can be severe. The important takeaway isn't fear, it's awareness. Often the steps that help protect your heart are simple: good oral hygiene, regular dental care, and paying attention to ongoing symptoms can make a real difference. A healthy mouth plays an important role in overall health, including heart health. So if you notice bleeding gums that don't settle, don't ignore it. It may be a small sign that something needs attention. Here's to your health. If you or someone you know has a heart condition that puts them at higher risk, consider sharing this video with them. And as always, speak to your own doctor or dentist for personalized medical advice. Thanks for watching.